If I were newly diagnosed with WHIM syndrome, I think I would try to find information that told me more about it than maybe the doctor I'm immediately seeing would have at their disposal. I might have to ask the doctor or the nurse or someone for help with understanding it. But if it were me, I would search for information first. I think that I probably would say, do you know anyone else who has it? Or how can I connect with someone else who has WHIM syndrome? And if the doctor didn't know, I think I would try to find, again, a resource on the internet these days about families or other people who might connect me so that I get a broader picture of what I have. One of the things that patients usually want to know, and I would want to know if I were the patient, is what's going to happen to me. And so I would want to know about the natural history of the condition, what are the problems, as I mentioned, of accumulating morbidity from something, and then what I could do to interfere with that. And if it were me, I would be looking for conventional therapies and new or experimental therapies, knowing that medicine is advancing so rapidly. The one approach, of course, is the wonderful resource of the internet to find reliable information. And you have to be crafty, I would say, to find reliable information, because there's lots of information now on the internet which is commercially driven or driven by someone with a bias of some sort. But really, it's truly an incredible resource for all of us. And so finding reliable sources of information on the internet is the easiest resource. The second resource is that there are family groups that form around a specific problem. And that's going on more and more. So connect with other people with the same problem, especially for rare conditions, is a very valuable thing to do also. And third is to look for expertise. And in my life, I spend lots of time, almost every day, helping somebody a long way away with at least some guidance about how to get to better health care for their specific problem. People want to come to see me, and I usually say, don't bother, it's too far. Let me help you find somebody nearby who can help you. And that kind of a resource, of however it's fashioned, is really very valuable to individuals. So I would say using the internet, using family groups, and trying to find somebody who will help you, not necessarily do everything for you, are the real strategies that work. Well, I really believe in patients advocating for themselves. This is a good example where no doctor could know about all the genetic diseases that may happen in a practice. There's thousands of these diseases now that are single gene mutations known to cause specific diseases. So patients, though, have the persistence with their problem to look for information and to find information and to become advocates for their own welfare. And I think families and parents do that also. And I think it's really very valuable. I usually say to patients, I'm very interested in what's wrong with you or what illnesses you may have, but you're the one person in the world who's more interested than I am. So persist.